Hello viewers, I am Dr. Kona Himabindu Reddy, consultant pulmonologist. Snoring is very common. Anyone can snore at some point during their life. But in few people, snoring is associated with obstruction at the level of nose or throat during sleep, which definitely impacts the airflow through the throat during sleep and leading to the low oxygen levels in the blood. So, persistent recurrent episodes of snoring associated with breathing difficulty during sleep may lead to the heart attacks and brain strokes, uncontrolled diabetes, and sometimes very high BP. And snoring definitely interrupts your sleep, which lead to the excessive sleepiness, more sleepiness during daytime, which sometimes may lead to the accidents while driving, and also interrupted sleep may lead to the lack of concentration and may lead to the lack of concentration. Snoring definitely interrupts your sleep. Interrupted sleep may lead to the excessive sleepiness during daytime, lack of concentration, easy fatigability, excessive urination during sleep, and also early morning headaches. If you do have any snoring during sleep, I would suggest to go and meet your pulmonologist and better to go for an evaluation. Thank you.